Hi guys, my name is Prince Ichie. You welcome back to the channel.
Big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
How much do you think undocumented immigrants pay into the tax system every year?
Zero.
Nothing.
Probably nothing.
Undocumented, I would guess zero. Why would they pay anything?
My guess is nothing.
Since they're undocumented, $0.
$100. $100.
Undocumented immigrants in the United States cannot receive health insurance from Obamacare, from Medicaid, from Medicare. They are barred from doing so. And if you tell me, oh, but I know my tia, primo, they're doing that illegally. That is illegal. Okay?
Medicaid has never been on the chopping block.
I'm not going to vote for Medicaid cuts, benefit cuts.
You will see no cuts in Medicaid payments.
Medicare, Medicaid, none of that stuff is going to be touched.
They talk about Medicaid cuts. Everybody's going to be thrown, according to Democrats, into all these horrible situations. There's only one problem. The word Medicaid is not even in this bill.
You've heard the rhetoric, you've seen the rallies. Build the wall. America first. The MAGA movement promised to fight for forgotten Americans. But what happens when the fight is so reckless, so sloppy, that it's backfired catastrophically? Today, we expose a political blunder of epic proportions, a story so ironic, so jaw-dropping, you won't believe it's true. A powerful faction within the MAGA movement pushed for a radical new law, their goal, to strip all federal healthcare benefits from undocumented immigrants. A brutal hardline policy designed to rally their base. They called it Protect American Health Act. In their rush to punish, they didn't read the fine print. The legal languages they drafted was so broad, so poorly written, and it didn't just target specific group. It dismantled the entire federal healthcare benefit framework. That's right. The very law designed to kick immigrants off healthcare accidentally zeroed out the fundings and legal authority for Medicare and federal retirees' benefits. Think about that. The 65 years old Trump voter in Florida, the retired factory worker in Ohio who voted America first, they all just had their health care put on chopping block by the politicians they elected. The political equivalent of trying to punch your neighbor and accidentally punching yourself in the face. This is a spectacular display of incompetence. So guys, let's get into the videos.
How much do you think undocumented immigrants pay into the tax system every year?
Zero.
Nothing.
Probably nothing.
Undocumented, I would guess zero. Why would they pay anything?
My guess is nothing.
Since they're undocumented, $0.
$100. $100. 2022, they paid $96 billion into Social Security and Medicare, just undocumented system. They pay it into the system.
Okay.
So through ITN number.
So undocumented immigrants?
Undocumented immigrants. They pay Medicare, they pay Social Security. They don't get Social Security.
Right, but they pay into it.
They pay into
I
it.
wasn't aware of that.
Yeah.
I wasn't aware of that.
Big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
It's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance because if you're not working, you're gonna lose your health insurance, and then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident, and for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day, you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that, for you, for her. Now, thank God that she has successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all. You're going to be in poverty forever, and you're going to lose your house, you're going to lose your home, you're going to lose everything that you ever worked for, and you're going to have to move in with your kids. So I hope that you have fucking rich kids, because you just made that little tiny entitlement that you're going to need fucking smaller. I would like people like you to think of the future. You're gonna need it. For you, it's probably gonna be a couple years, all right? Because I could tell you've probably been eating butter and fried chicken for the last 20 years.
He needs to come down on our level and live like we do. He wouldn't survive, I'm afraid.
Do you have Medicaid right now?
Yes, I do.
Yes.
Yes.
Yeah.
Yes, I was just approved a few weeks ago.
You know, there's this narrative that a lot of people on Medicaid are lazy. Do you feel that's accurate?
No, absolutely not.
No, I'm not lazy. I try to get a hustle as much as I can.
No, I think they just can't help themselves.
Well, no, because I work. I do mechanic work, and so it kind of fluctuates. I have a bunch of health problems. I can work, but eventually I'll be where I can't work.
Just got laid off.
I'm a hairstylist, so it really just depends on how much I bring in due to my clientele. I'm currently trying to get like a part-time job, like a night job, just to put more money on the table, especially with the economy going up in prices and stuff.
Can you tell me about how it would affect you if you lost your Medicaid coverage?
Oh Lord, I would have absolutely, totally nothing. I would not be able to live, period. I wouldn't even be able to eat.
It would affect me real bad because I can't support myself. It would be a very big impact because that's all we got right now.
I have some possibly terminal illnesses, and I've had to postpone it waiting for Medicaid. And I'm sitting here literally just trying to survive.
I wouldn't have no coverage at all. My grandchildren wouldn't have any coverage. My daughter wouldn't have any coverage. And we can't just go to the doctor as needed.
I'm curious if you could say something to Representative Johnson about cutting Medicaid, what you might say to him.
Well, Speaker Johnson, I can only say this. If you ain't had the shoes on your feet to see what it feels to be like under these conditions, then you won't never know it. Come out here and stay a little while.
Part of that bill would also give tax breaks to the richest 5%. So billionaires would pay less in taxes. How do you feel about that?
It's basically let's keep the rich rich and the poor poor. They have the money to pay for it, so why would you make them pay less?
They're gonna stay a billionaire, and then we still gonna be poor.
I'm sorry that they would not meet with you. It's bullshit. So I'm just super disappointed. We went in to see Senator Ernst. Hi, I'm Nancy, and this is my son Charlie, and we were wondering if Senator Ernst was available to meet with us today. The senator has a pretty full schedule. We've been emailing her, and we haven't heard back from her. And so we're in DC today and tomorrow, and we would love to be able to meet with her to talk about her most recent comments.
People are not, well, we all are going to die. So, for heaven's sakes.
We just would really like to be able to have the senator put a face with this big, beautiful bill and how it's not so big and beautiful for kids like Charlie, so that she understands that kids like Charlie are going to be negatively impacted. It's okay. You don't have to cry. I know. It's okay. It's just he's a person, right? And he shouldn't be cut. So again, we show up and there's just a bunch of lip service.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Hurting are the poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now?
seeing what you see?
With either one.
You just wouldn't have voted.
None either.
Like the new big beautiful bill?
Well, yeah. I mean, we'll probably lose our health care and our kids might suffer, but our leader's going to be richer, so we're okay with it.
Ma'am, you just lost your home because of the new bill. Do you regret voting for it?
Oh, not at all. My family's homeless, but at least the libs are mad.
So you were telling me that people are unaware? They're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
Hatred and bigotry is about to cost red states and red voters their hospitals and healthcare, and they have no understanding that that's what's going to happen and that the Democrats are actually trying to fight for them. See, Trump's big, beautiful bill cuts Medicaid, and here's the truth. MAGA has no understanding of how Medicaid works. See, Medicaid isn't just some line item. It's a federal and state partnership. The federal government pays a percentage of each state's Medicaid cost through something called FMAP, the Federal Medical Assistance Percentage. And here's the thing. Red states get the highest FMAP. The poorer the state, the bigger the federal share. For example, Mississippi gets 77% of their Medicaid paid by the federal government. West Virginia, 75%. Kentucky, Arkansas, Louisiana, 70% and more. Meanwhile, wealthier states like California only get 50% of the Medicaid bill federally funded. New York, just 55%. So when Donald Trump and Republicans slash Medicaid, it's not blue states that collapse. California and New York already fund nearly half of their own programs. They'll manage. It's red states that get destroyed. They depend on the federal government's dollars. They depend on the very federal funds that MAGA is now cutting off. So what happens when that money disappears? States are going to kick people off Medicaid who currently qualify. Rural hospitals, which are already barely hanging on, are going to shut down. Seniors, kids, pregnant women, and people with disabilities are going to lose care. And here's the ironic part about it. Most Medicaid recipients live in red states. Blue states will be fine. Red states will lose their safety net. And meanwhile, the Democrats are the ones fighting to protect those very programs in the budget negotiations happening right now. Democrats are trying to keep Medicaid so that the rural hospitals don't close, so that families in Mississippi, West Virginia, and Kentucky don't get abandoned. So let's call this what it is. Trump and MAGA are cheering for cuts that will devastate their own voters. Democrats are trying to save, even while being vilified for it. MAGA doesn't drain the swamp. MAGA drains your hospital, your doctor, and your lifeline. And the cruelest part, the very voters that are cheering the loudest for Trump will be the first ones thrown off their health care.
So I work in long-term care. I am the assistant director of nursing at a behavioral health facility. And I would say that about 98% of our residents are Medicaid or Medicare recipients. So of course I have been thinking nonstop about all of the cuts that have been made, because not only will I be impacted, but I also have, over 100 residents to think about, and it is absolutely devastating. But someone had mentioned today that there was an article that had us listed as one of the facilities that would be on the chopping block if these cuts do the damage that they anticipate that they will do. It is estimated that there are about 57,000 people currently living in nursing homes in my state. Where are those people supposed to go? Many of them came in from the streets. Those that didn't, they don't have anywhere to go. They don't have family to live with, or they'd be there now. There are approximately 703 certified nursing facilities in my state, and 579 of them are on this list of being at risk to close due to these cuts. 57,000 people at risk in one state. And that doesn't even count the people that are living at home, should be in a nursing home, will have no opportunity to go to one. That doesn't even count all the people that have been denied and that are sitting in hospitals waiting. That doesn't count all the people that have private insurance or could be private pay, but there's not going to be any facilities to house them. What are we going to do for our elderly and disabled? Like, this stuff keeps me up at night.
So the Medicaid cuts are here, and if your loved one depends on home health care, you might want to listen up. I'm not here to scare you. I'm here to tell you what I'm living right now, my fears of the future. My wife's been on Medicaid for about 3 years. She's only 52, but she's been sick for 18 plus years. She cannot be left alone. Medicaid is how I have an in-home health aid. It's the only way I can actually work or go to work. And now these rules are changing. These stricter eligibility checks. And there's some sort of a work requirement that I can't quite figure out yet. Some of the states are scrambling to decipher the code. I live in the state of Florida. I don't know yet if they've published their updates. But my worst case scenario is I lose in-home health aid. That's going to unravel things pretty quickly for me. I've already reached out to my caseworker. Now it's over the weekend because she's not going to answer right away, but that's the first thing I did is I reached out to her and I left her a voicemail. And I'm going to be very persistent with her until I hear back on what do they know and how are these cuts going to affect my personal case. If you're in the same shoes as me, I expect you to do the same thing. Whoever manages your Medicaid case through whatever program, you should reach out. Don't sleep on this. Don't wait for them to just tell you you lost everything. You need to be proactive. Let me know your thoughts. Please don't make this a political debate. Just let me know your thoughts on how this might affect you. I love you guys.
Now, the architects of this chaos are scrambling. They are holding emergency meetings, pointing fingers and desperately trying to undo what they have done. But the damage is real. Seniors are getting scary letters. Premiums are set to skyrocket, all because of the hate-filled political stunt that blew up in their hands. So the next time you hear a political promise, a simple solution, remember this: incompetence is a dangerous weapon, and today they aimed it directly at their own heartland. What do you think, guys? Is this the biggest political self-own in history? Sound off in the comment below. And if you believe holding power accountable, smash that like button and subscribe so you don't miss what will happen next. See you on the next video.